Hello everyone, my name is Dr. Brian Campbell and I'm going to be your instructor for this course and I'm looking forward to it very much. I wanted to take a moment to give you a little bit of my background so you understand who I am and what experiences I have in the area of psychopathology. I did my undergraduate degree in psychology at Grove City College in Grove City, Pennsylvania, up in northern Pennsylvania. It was a Christian college and I really enjoyed that experience very much. After that experience I went to Scotland. My father was born and raised in Scotland, came over in the boat. So I decided to go to the homeland to study psychology, and I was doing my doctorate over there. And it was very interesting. It was a different type of experience altogether, and I'll hopefully have some time to talk to you about that. But you'll be interested to know that for the 6 years that I was there, I had no tests, no exams, no classes. I trained mainly with a mentor named Bob Grieve, and I learned a lot from him, and the criteria for completion of a doctorate in Scotland is a lot different than the criteria for completion of a doctorate in the United States. The criteria over there was an original contribution to mankind, whereas over here I think we tend to just do a lot of work on taking tests, and I hope that during this course you'll do more than just take tests. You'll really try to take this information to heart. I want to tell you, everything you will be learning here you will use as a counselor. Back to my story. So I did my doctorate over there, and then I returned to the United States to do a pre-doctoral internship in psychology, in clinical psychology, at the Veterans Hospital in Pittsburgh, Pennsylvania. That was a 2,000-hour, one-year internship, intense, probably 70 hours a week. And I dealt with mainly Vietnam vets, but a lot of World War I and World War II vets as well. And there I first experienced the full range of psychopathology. I had never experienced individuals with schizophrenia, paranoid personality disorders, bipolar disorders, actually pedophiles, etc., etc. I really saw a whole lot of different people there with a variety of psychopathologies. And as part of that work, I also did an internship, or an externship they call it, in the Child Development Center in Pittsburgh as well. So I got to work with a lot of children as well, and also worked in diagnosis there. A lot of the pre-doctoral internships involve diagnosis. Now interestingly, that pre-doctoral internship was all based on psychoanalysis. So I trained originally in psychoanalysis, which most psychologists back in that day and age did train in. However, I did get further experience in a variety of different modalities and of course experienced a whole lot of different types of people. In Scotland, by the way, I forgot to mention, I did my research over there mainly in the area of mental retardation and psychopathology there. And I studied throughout the hospitals in Scotland, actually even in some castles I would go and study, where they had put the mentally retarded people, they took them out of the population and put them into these facilities, often in old castles. So I had a lot of experience there in the realm of mental retardation. After my pre-doctoral internship, I later on did a postdoctoral fellowship in developmental disabilities at Rhode Island Hospital Center for Reproductive Medicine and Child Neurology. That was a very interesting experience there. I trained with a radical behaviorist there, so I had gone from basically experimental psychology to psychoanalysis to radical behaviorism, and hopefully you'll understand and know some of the tech terms that I'm talking about there, but it's quite different from anything else I had experienced. And while I was there, we worked with the most violent and aggressive people, most disturbed people in the world, probably in the state hospitals around Rhode Island. And I got to experience people with a wide range of psychopathologies again, just about every type of disorder you could possibly imagine, in children and in adults. And I trained for that year during the fellowship. It was mainly involved with handicapped children, but I also dealt with severely disturbed self-injurious people, people who killed people, homicidal, just a whole range of experience. So following that, I went to be a professor at Nova University in Fort Lauderdale, Florida. Actually, it's called Nova Southeastern now. And I taught there in our doctoral programs in clinical psychology, our PhD program and our PsyD program, both of which were APA-approved clinical programs. So I taught there for 10 years, and during my course of study there, during my teaching there, I did research, and I also taught a variety of courses, including adult psychopathology, and child psychopathology. So really I did sort of around the world of psychopathology. So I did that for 10 years, so I have a lot of experience in the whole realm of psychopathology. Back when I started, which is a long time ago, we had the Diagnostic and Statistical Manual number 2. And of course we've since moved on way further into different versions of that manual. But all these diagnostic categories are very important to keep in mind. You will be using them throughout your career, as I mentioned. So I then trained in radical behaviorism, so I have a lot of different modalities, and then eventually in the university I moved to cognitive therapy. So in the final analysis, then I moved on and moved out of the university to be a private practitioner and actually a Christian counselor. And there I formulated a theory called Christian cognitive behavioral therapy, and that's primarily the modality that I use, and I will be introducing that to you during this course, and I have some handouts on that. And it's a way of looking at the world, and I think it's a very comprehensive way of looking at the world, so I hope you'll take time to evaluate it. As I trained students over a lot of years, I know that it's so important to help you understand how to think about psychopathology, how to think about the Christian faith and how that blends with and how that dovetails with these different categories of psychopathology. So I want you to take time to listen to my PowerPoint presentation on my internet site, which I will be showing you how to link to, and that will give you my worldview and essentially the Christian cognitive behavioral therapy model that I hope you'll be able to use to see these different pathologies in the light of that. And I think it'll be very helpful to you to have that paradigm, because I use it every day in my counseling. Every day I use that modality, because I believe that God is concerned about our behavior, how we behave, and I believe God is very concerned about how we think. Over the years I also wrote 3 books, mainly scriptures, that I use in counseling, and I would suggest that you have a look at those as well, because I use those all the time in counseling too. And one of them, especially the latest one called Christ-like Walking the Walk, includes some of the theory that I've been talking to you about. The first book that I wrote was called Pearls, Scriptures to Live By, and that was just a compendium of scriptures that I used for counseling. And then I consolidated that into a subsequent book called Godly Counsel, which I think is very, very important for you to have a look at as well. So I hope to give you a framework from which you can look at psychopathology. And those are my experiences. They're pretty vast and pretty varied. In my private practice over the last 20 years, I've seen children and adults. I always suggest that I see people from womb to the tomb. I actually don't see very young children very often anymore, but I certainly work with parents who have very young children. And I work with handicapped children, I work with teens, I work with adults, I work with couples. So I have a lot of experience in pathology, and especially, mainly, I'm working now in Christian counseling, so I utilize that framework to help me understand this whole area. So I look forward to working with you in this course, and it's going to be a difficult course, so hang in there and get going right away on it. Thanks very much. Bye-bye.